Numbers on a spreadsheet can't capture the heartbeat of a neighborhood. To truly understand a community's health, you have to read the history paved into its very streets. Welcome to Lincoln Heights, Los Angeles' oldest neighborhood. It's not just a spot on a map, it's a living, breathing collision of deep-rooted tradition and unyielding resilience. For generations, this has been an immigrant heart. Today, 45.8% of the population is foreign-born.
So I grew up in Lincoln Heights, which is a few blocks from here, or no, I guess a few blocks from the health science campus. It was a wonderful experience. It was, I mean, obviously it was a long time ago. Yeah, it was a nice neighborhood experience. I guess like any kind of neighborhood, I always imagine like the movie Sandlot, where the kids play baseball and they go to the baseball field and a bunch of kids around the neighborhood go and hang out all the time. So it's that type of description for me. Rough at times, but any neighborhood is. But I really enjoyed the experiences when I was there. So it was great. It's changed a lot since, but yeah.
Wellness here isn't just a clinical term. It is found in social cohesion, just like when parents and children from the Lincoln Heights Community Coalition rally outside Hillside Elementary to protest warehouse developments that threaten their air quality. It is found in the way people stick to their traditions while navigating the modern pressures of East LA. Here, health is a collective effort.
So I actually work for Parks and Recreation. I work at Downey Recreation Center. So we have many events, many childcare options for kids in the community to come and either play sports or childcare options. So yeah.
However, the evolution of the last 20 years has brought structural challenges. Despite the cultural richness, the social determinants of health reveal deep-seated disparities. Over 30% of the population is trapped in persistent poverty, a cycle that has lasted over 3 decades. Access to fresh produce is 14% lower than the county average. Furthermore, lead exposure risk is high, with toxic fumes from the local train lines creating an environmental score of 6 out of 10. This brings us to a striking paradox. Lincoln Heights sits in the shadow of world-class medical innovation at USC. But for many longtime residents, these resources feel like a world away.
So I've definitely seen a lot of more gentrification in Lincoln Heights, new people moving in because of the hospital. For example, not many Latinos and Hispanic or Asian people. So that's definitely been a change in my community, I would say. I don't think it's very much negatively impacted us, but I think a lot of people who don't have the right health care don't necessarily have the opportunity to go to that hospital specifically, so they have to go to different locations outside of our community, which has been more difficult for them.
With 20% of adults uninsured, residents often face a health professional shortage area score of 17, indicating a high priority need for primary care. Instead of the nearby Keck facilities, residents rely on Arroyo Vista Family Health Center or White Memorial Hospital. They turn to the LA Care Community Resource Center, which provides essential survival health, food pantries, Wi-Fi for telehealth, and free rides for seniors. While the USC presence is abundant, it is often hard to access for lower-income residents who have relied on nonprofit, community-based care for decades.
So I do live in Lincoln Heights. I've lived here my entire life. I'm a social worker for the Department of Public Social Services, and our recipients are typically low middle income individuals with Hispanic or Asian backgrounds, and they're part of the aged and disabled community. A lot of individuals in this community try to not take advantage of the healthcare system, so they do so much to try and only use basic level healthcare available to them, so like their primary doctors and any specialists if they're referred to, but they don't understand and have the knowledge and education that they have so many other resources available to them in terms of seeking more assistance to maintain their health. Everyone that is in Lincoln Heights has, for the most part, been here for years. So I think that has a lot to do with why, as a social worker, I see a lot of individuals with similar medical health conditions. I will say it is very beneficial to live in Lincoln Heights because I've had the opportunity to kind of just walk to my recipient's home. and also have a different level of understanding as to what needs they have, what struggles they have, and what they've experienced.
Lincoln Heights is a community that has survived historical oppression and systemic neglect by leaning on one another. For future healthcare providers, the lesson is clear. To treat a patient from Lincoln Heights, you must understand their environment. You must acknowledge the 50% housing burden, the linguistic barriers, and the cultural humility required to serve a population that has been their own best advocate for 30 years. Wellness in Lincoln Heights isn't just the absence of disease, it's the strength of the community to thrive in spite of the odds.